Did you know that men can have breast cancer? Yes. In as much as breast cancer is commonly found in women, men can have breast cancer because men have breast tissue. In this video, we are going to be discussing self-breast examination, and I'm going to be answering 4 of the major questions that people usually ask about self-breast examination. So let's jump right into it. The very first question people usually ask is, when should I do a self-breast examination? The answer is, you have to do a self-breast examination at least once every month. Now, for women who are still menstruating, you can do it 3 to 5 days after your menstrual cycle. But for women who are postmenopausal women, you just pick a time in the month where you always do it. For instance, if you do it in the first week of this month, subsequently you have to do it in the first week of every other month. The second question that people usually ask is, what do I look for when I'm doing a self-breast examination? Now, during your self-breast examination, which we'll demonstrate later, you'd see that you do 2 main things. The first one is an inspection, where you are looking at the breast, you are looking for any abnormalities, you are looking for any skin changes. So if you see any rashes, any bumps, you see any reddening of the skin, you are looking at the nipples to see, are the nipples pointing out or are they pointing inwards, which we call inverted nipple. You are looking if there's any spontaneous nipple discharge. You are looking if there are any ulcers. You are looking if there are any dimpling. Dimpling is simply the skin drawing in like you have a dimple, okay? These are some of the things you are looking for on your inspection. And then you go on to the palpation bit, which is when you are touching. You are looking for any lumps, any bumps. You are looking for any areas of hardening, any hard knots, or any unusual abnormality that you feel in your breast. You are also feeling for any form of pain, which is not associated with your menstrual cycle. Now, jumping into the third question, people would ask, after I've done this self-breast examination, if I find anything abnormal, what do I do next? Simply do not panic. You need to understand that majority of the things you see in a self-breast examination, even if they are unusual, are not pointing directly to breast cancer. Data shows that over 80% of the abnormalities you would see in your self-breast examination are not breast cancer, so don't panic. What do? Just get checked into a hospital, let a doctor check you out. They'll do a clinical breast examination. If they need to order some imaging like a mammogram or an ultrasound, so for people over 40, you would do a mammogram. For those under 40, a breast ultrasound. They will do that, and then if they find anything unusual, they treat it early and you can go on with your life like it never happened before. Now, to our final question, people usually ask, is breast cancer preventable and is it treatable? Now, for the first part of the question, breast cancer is not entirely preventable because some of the risk factors are inevitable. For instance, if somebody has a genetic predisposition, it runs in their family, so they've inherited a particular gene, there is nothing we can do to change your genetic makeup. However, some lifestyle modifications can help to reduce your risk of developing breast cancer. Some are eating a healthy diet, exercising regularly, maintaining a healthy weight, reducing your alcohol consumption, avoiding smoking, and also reducing a lot of the hormonal therapies that people indulge in. When you do these things, you reduce your risk of having breast cancer in life. And then is breast cancer treatable? Depending on the type of breast cancer that we are dealing with, and also the stage at which it is diagnosed, breast cancer can be treatable and even curable. If it is picked up early, you would see that we can actually treat the person, the cancer disappears. If it is surgery, we do surgery. If they need chemo and then radiation therapy, we do that. And they can move on with their lives like they never had breast cancer. Let's always remember that early detection saves lives. And so if you notice anything unusual, do well to have it checked. I am Iya the medic, and I'll see you in the next video.